There are medical problems that you may be too embarrassed to discuss with your physician. One such problem is incontinence. It is a common complaint that can get in the way of your career, even your family. In our Check Your Health report, Mary Nichols has a look at 2 treatment options, including one that's been around for centuries.
Hi, Mary.
Hey.
How you doing?
Good. I begin with my personal physicians sent me here because I had reoccurring bladder infections.
Bladder problems, or incontinence, is a common complaint for many women. It is embarrassing and can get in the way of regular life. There are medications to treat incontinence, but doctors are also using a more holistic approach.
And when they studied this, they found by putting an acupuncture needle in a nerve behind the ankle, stimulates the bulk of nerves in the spinal cord that go to the bladder. Stimulating the nerves to the bladder modifies how it behaves, and the urgency in incontinence is improved in about 2/3 or 3/4 of patients.
Dr. Richard Lebaski is a urologist at Altaview Hospital. He says a technique similar to acupuncture is one tool to help treat incontinence. In more complex cases, surgery to insert a nerve stimulator is another option.
This wire stimulates the nerve going to the bladder, and with 2 steps, again with outpatient surgery, with some local anesthetic, patients can do very, very well with this.
Before medications or acupuncture or even surgery, you first need to talk to your doctor. Dr. Lebaski admits it's not an easy conversation to have with a physician.
An extremely common problem, and indeed there are 2 things. One is patients are embarrassed, they don't bring it up to their doctor or family members to even talk about getting advice or therapies that might be appropriate. And the other thing is that they fear that the therapies that they might have to undergo may be, well, extremely painful, very invasive.
Mary Clark tried medications and didn't like the side effects, so when her doctor suggested acupuncture, there was no question.
Right now I feel totally cured. They warned me that I might have reoccurrences, and they say I just need like a recharge.
Mary Nichols for Check Your Health.
We only barely scratched the surface describing treatments for incontinence. If you'd like more information, you can, of course, go to our website at KUTV.com and then click on the Check Your Health link.